This was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time.
Welcome to Wellness and Dentistry, where today we're going to talk about the fact that DSOs, or DPOs, as we'll explain in a minute, are finally putting time and money toward mental health. I'm joined by my good friend and my co-host, Dr. Kyle Stanley, who's a dentist, tech entrepreneur, speaker, and researcher. And my name is Dr. Martin Mendelson. I'm a disabled dentist, coach, speaker, and author. My first book, One Move Makes All the Difference, is available wherever books are sold. And together, we've helped thousands of dental professionals pursue wellness and dentistry. And if you're unfamiliar with us, we invite you to check out our respective links, websites, and course offerings on our combined website, wellnessanddentistry.com. So, Kyle, how you doing, man?
Hey, I'm doing good.
Yeah.
This topic of DSOs, DPOs, group practices, whatever you want to call them, corporate
Yeah.
offices, whatever you want to call them, finally supporting mental health has been really a crusade that you and I have been on for many years.
Yeah,
And it's nice to see that it's paying off.
absolutely.
So we did a course recently in Dallas with MB2, and if you don't know who MB2 is, they're fairly large. They have about 800 practices. My brother has two practices with them, and that was part of the connection that we had. But what's cool about MB2 is that they have a dentist owner,
Yep.
and it's owned by him basically. And I don't know if he has any other investors or not, but getting to meet Dr. V and seeing the culture at
Mhm.
MB2 shows that not all corporate offices, not all group practices, not all DSOs, DPOs are created equal. And this is not like an advertisement for
No,
MB2,
no.
but what was so cool to see was they really care about their doctors.
Yeah, totally. And my connection to them, I have two really good buddies that went to dental school together, started a practice together, and these guys are exceptional clinicians, exceptional business people, and they ended up joining forces with MB2 a number of years ago now and have been nothing but happy. And so between Kyle's, familial connection, my friend connection, we were super excited to even just talk to them about the possibility of working together, let alone how excited we are about how well things went and what the future looks like for our combined efforts. And Kyle's right. We conducted the course in their headquarters, which is near Dallas Airport in Dallas. And what a beautiful campus, if you will. It's over multiple buildings. And I've been in a lot of corporate offices, as I know you have too, Kyle. And there's a lot you can sniff out from being physically there. And I got to tell you, it kind of reminded me of being at Spear in the old days,
Mm.
relative to people's enthusiasm, engagement, and passion. And, the entire team we worked with, from Lindsay to Kara to everybody, was just unbelievable. And so, not that I'm going to speak for you here, not that Kyle and I had any doubts about the impact of our teachings, but then to do it within that guise, if you will, really, at least for me, was so heartening to see how impactful this is becoming over and over and over again with people from all different, shall we say, dental walks of life, right?
Yeah. And so we did our normal Lightside Live that we always do, and
Yep.
we've done to a ton of different
Mhm.
doctors from all over the world. What do you think were some of the biggest takeaways, some of the biggest breakthroughs that we saw?
I think it was consistent with everything else we've seen over the
Hmm.
years. I mean, it was refocusing, understanding that living a value-driven life uh, can be very impactful and very lightening, if you will, realizing that, okay, because we do this value sort exercise as part of Lightside Live, and basically it bubbles up what's important to you. And so, you start with this deck of literally 70 cards that all have values on it. And people end up hating me by the end of this because I make them go down to like three. And it really challenges people to focus on what's important to them. And just like in every other course, we start with the Wheel of Life, which is not unique to us. It's been around since the 1960s as a coaching tool. And it blows my mind. Everybody pretty much always has the same reaction, which is, yeah, I knew that, i.e., my imbalance. But yet, okay, now I have to face it and deal with it. And so it's just it's a really impactful 2 days, frankly.
Yeah, I see a lot of the breakthroughs of just finally putting effort outside of my clinical work.
Yeah.
We had a lot of people come up to us afterwards and send us texts and
Mhm.
voicemails afterwards saying, this was a total breakthrough for me.
Yep.
I know what I'm going to focus on. And it was just, I mean, we say this every time that we do this course,
Yeah.
but it's just so damn rewarding to see a group of doctors. And what's cool is we also had an office manager join us,
Yes, we did.
and we had a
Regional.
regional
Yeah.
manager join us. So both non-dentists.
Yep.
And to see them both understand what the dentists are seeing, but also for them to see from like a leadership standpoint and even a self-care standpoint. I think that was one
Yeah.
of the big takeaways that I saw from this group too, was they finally were saying, I need to take care of myself.
Yeah.
If I want to be this high performer, if I want to lead this practice, lead this business, be the clinician, be the owner, be the CEO, be the mom, be the dad, be all these things I want to
Mhm.
be, I need to actually take care of myself.
Yeah. And honestly, shout out to Care Credit because they help financially support that day as they have done in the past. And so this was a different individual that joined us this time, and he works with quite a number of DSOs, and he came up, I believe, to both of us independently, right? And
Yeah.
and just said he's never seen anything like it. And he also said, which is talk about a takeaway that we get quite often, he didn't know what to expect.
Uh-huh.
And yet it was so impactful to him. And now he even had a window into what are some of the, shall we say, mental or psychological challenges that people have in practice and how important and how impactful those are. Because, like in recovery or in, your Ripple framework, the first step is always identifying that, Houston, we got a problem. And so when you start to do that and start to get real about it, everything starts to change.
Yeah, that's always cool to see during these 2-day
Mhm.
events is when you see people's eyes kind of light up like, oh my gosh, that's me.
Yeah.
And it's like you and I are seeing this happen in real time, that they are
Hmm.
having the self-realization that, oh, I don't appreciate my team as much as I need to, or
Yeah.
I need to learn how to communicate better, or I need to take care of myself physically, or any of the things that we teach, or, I need to live with my values and my priorities. But seeing it actually happen on someone else real time is something that's really hard to explain. And it's something that
The,
is just so rewarding for me.
I think the other big thing, and this is obvious from a just a basic perspective, but the impact of it is profound, which is I'm not alone.
Yeah.
And that comes up every single time. I'm not alone. My problems are similar. And just the bonding that you see there was quite impactful. We also had a practice owner and two associates, and the two associates were younger. And kudos to that man for bringing the two associates because talk
Huge.
about an amazing experience to be able to run a practice, if you will, from the lens of, okay, clinical excellence, business excellence, but also from a mental health perspective. I
I want to
think that's
read I
the,
want to read a text that one of our participants
yeah.
sent to us, and I
Before you
won't say.
do that, though, wasn't
Yeah.
that like the first time that's ever happened, come to think of it, where we had like a
Bringing
practice
associates.
owner? Yeah.
I think it is.
Yeah. So that's kind of cool.
Yeah. No, really cool to see. And you could see them bonding through this
No,
time and
totally.
understanding each
Totally.
other.
Yeah.
So one of our participants texts you and I afterwards and
Oh
said,
yeah.
I just have to give you this feedback. Since I've come back from Dallas, I feel like my eyes have opened to seeing Technicolor. I feel liberated from the shackles of my own thoughts and fears. You have provided me with the ability to think beyond the grind of my profession. I have talked about this workshop to every single human being. Thank you, thank you, thank you. I can't believe the difference in my perspective. I want everyone to feel this way. I mean, what an
It's
amazing
amazing.
message to get from
Yeah.
someone.
And it's really hard for us to convey this stuff. And, props to you, my friend, for always getting video testimonials, because, marketing speak only goes so far, right? And
Yeah.
so what I'd say to people is, because we have a pretty big wait list now, and what I
Yeah.
find fascinating is when we do release a course date, not everybody from the wait list immediately puts their hand up. Now, granted, there's, date conflicts
Travel.
and stuff. I get that
Yeah.
point, but really deciding that you're going to do this can make a huge, profound impact in your life. And, in my teachings, in my book, I have this concept, NBCA, which is kind of how to get you out of jumping a catastrophe. And NBCA stands for notice, breathe, choose, and then act. And I always teach the idea that choosing to do something between your ears is not the same as actually doing it. And
Mm.
so it's almost as if I'm speaking to y'all on the wait list, that you've chosen to put yourself on the wait list, but acting to sign up for the course, that's a different thing entirely, and they're not the same, right? So
Well, we always say this is like, don't listen to us,
yeah,
but go and watch the testimonials. Go and watch the video testimonials that people ask us if they can help other people.
mhm,
Because there was someone in the course this time that said, I want to do a video testimonial because it was one of the video testimonials that got me to sign up and it
that's
made
right.
such a huge impact for me. Remember
That's
this?
right. That's right. Yeah.
And it's like, yeah, don't listen to us. Because we could sit here and say how great we are. And, anybody that sits around and says how amazing they are, I'm always a little, uh, you know, I'm always a little nervous around.
Yeah.
But listen to other people. And
No.
when you make your mental health a priority, what that usually means is that you are putting time, effort, and money towards something. And I
Oh
know
yeah.
that sounds weird because we're the guys that are, getting paid for doing these courses.
Sure.
But I think about this how I think about when I did my coaching, my business coaching.
Hmm.
And my first business coach was like $30,000. It was more money that I had spent on anything besides a car, a house, or maybe a dental scanner.
Hmm.
And
Hmm.
it completely changed my life. From a money standpoint, I made $114,000 in 7 days, just 3 months later after his
Which is
teaching,
amazing. Yeah.
which is crazy. But had he not made that offer to me, basically him making the offer to me and me paying this $30,000 check was me committing to myself.
Hmm.
And sometimes that's what this is. When people commit to this, is they're finally saying, you know what? I'm going to commit to myself because you and I both know when you put time, money, and effort towards something, you get better and you make
Yeah.
yourself get better because you're like, gosh, I invested in this. I got to get something out of this, right?
Oh, absolutely.
It's like when you
Absolutely.
pay for a gym membership, you feel bad if you don't go because you're like, gosh, I'm paying for it anyways.
Yeah.
I might as well use it.
And what I would say too is that, even if you're for whatever reason not ready at that point, you're already listening to us. So
Yeah.
keep listening to us. Kyle has courses, I have courses. My book has CE associated with it. And my
Hmm.
book is basically like having me as a coach, but in book form,
Yeah.
because every chapter has exercises, several of which are actually in Lightside Live. But the point
Yep.
is that just do something.
Yeah. Start moving. One
Start
move.
moving, right?
Yep.
Make one move to to make a difference. And I know that sounds trite and sing-songy because that's my book title, but it's true because one will always be greater than zero. One of my favorite phrases of all time. So,
And it's so cool to see. DSOs, DPOs, group
Mhm.
practices, corporate practices, making this a priority.
Yeah.
And I've said before that I don't care if DSOs make mental health a priority just so that they make more money.
Yeah.
Like if that's why they're doing it, I'm kind of like, okay, because they're gonna help people no matter what. But that's
Exactly.
not what this was. This was not
No.
that.
No,
This
not at
was
all.
helping the doctor from beginning to end, from front to back, thinking of them as a whole person. Because for those of you that don't know how it worked, the doctors had to pay a certain amount, about
Yep.
about a third or fourth of the price. But the DPO and the sponsors paid for the rest of it.
Yep.
And so this was like the doctor had to have skin in the game, but the group paid for a lot of it.
Well,
And this
and
was them saying this is important to us.
yeah, what I think is really cool too is, part of why that happened was our insistence. Because in the past or currently, they actually don't charge for CE within their doctors, within their
Oh,
DPO,
right.
which is a great thing. And at the same time, we're like, no, they have to have skin in the game and an investment. And
Yeah.
it was kind of a learning curve for both parties because,
Hmm.
then when you talk about a course, it's like the only one that they have to pay for. It's like, well, what's going on there? So,
Yeah.
but it kind of set it apart in a good way, uh, because nobody can make change, nobody can facilitate change in our lives except for us. Like no one's going
Yeah.
to do it for you, right? Whereas Mel Robbins likes to say, nobody's coming. And it's true. Nobody's coming. Nobody's coming to fix your mental wellness. You got to do it. Or your physical
Yes.
wellness. You got to do it.
And I've been in contact with some smaller group practices, like 25 or less
Hmm.
to work on their wellness and what they should do
Hmm.
for their practitioners and that kind of stuff. But never was it coming from the top down
Yeah.
and going directly to the doctors. And at this level, I mean, having
Yeah.
800 practices and
It's true.
saying this is a priority to us, and we are
Hmm.
going to subsidize a huge amount of this because we know how important this is.
Yeah. On a kind of a comical note, we were on their podcast, which was a real honor as well. And they kept saying to us, "God, you guys are like so smooth when you do this kind of stuff." And we're like, "We do this
We're on
every
a
week," and
podcast hours together all the time.
so
Yeah.
it's like we're used to talking to each other, so
Yeah,
it's all
for
good.
those of you that have listened to us from the beginning, I mean, we're now, I don't know, hundreds, what are we, 100 and this is probably
110,
109 or 10 or 10 or
yeah,
something like this. Yeah. So you guys have been listening to us for a long time. You know how we are. We go back and
yeah,
forth very well.
yeah,
So Martin,
absolutely.
what do you think the future holds for DSOs and mental health,
I
wellness in
think.
general?
I think that they're going to continue to embrace it either by choice or by coercion,
Hmm.
relative to just realization that things are changing and things are different. I would frankly love to see, at some point this leading to some greater presence at Dykema or women in DSO and those kind of things, with data relative to, okay, so Kyle and Martin did this course at MB2, and we've ended up impacting these number of clinicians. And by the way, within those clinician practices, I don't know, their attrition went down, their production
Hmm.
went up, whatever the data is,
Yeah.
to then kind of bring this to a broader audience because it is so incredibly important. And this isn't about Kyle and I, this isn't about selling courses. This is about the reality that we're 17 times more likely to take our own lives than the general populace. This is about the fact that we're 2.5 times more likely to have the incidence of panic disorder, anxiety disorder, and depression than the general populace. This is about looking to do something to help our profession. Just this past weekend was my dear friend Dan's birthday, who took his life a couple years ago. So this is not some fluffy thing. This is real. This is impacting a lot people's lives, and For those of you who've seen any of my lectures, I typically talked about my bestie, David. And so David used to work for Dan. And so we were texting over the weekend. And, he was saying, I think of him so often because we had so many great memories together. So this is this is more than just us. This is more than just courses. This is about doing something
Hmm.
that a lot of people have just given lip service to, frankly.
Yeah, no, and it's, you see your emotion, and those that are
Yeah.
listening, I'm sure, are hearing your emotion. And it's true, sometimes we need, even me, sometimes I need to sit back and think like people are dying, people are quitting the
Yeah.
profession, people are getting divorced because of this, people
Yeah.
are missing out on times with their children because of
Yeah.
this, they're in bad health state because of this. And I think sometimes even me living in this wellness realm, even I forget about this sometimes, and
Oh
I'm the one
yeah.
talking about it, you know? And it's true. It's you're right. It's more than courses. It's more than making money or any of this. This is just impacting people's lives,
Yeah.
and especially a profession where so many lives are being negatively impacted, you
It's
know?
true.
Unfortunately, that's just what the statistics show.
Hmm.
And I agree with you. I think this will grow. I think wellness in general is, of course, growing, just in the general population.
Yeah.
People are more aware of it. Mental health is more accepted. When you and I started talking about this, it wasn't, but really been huge changes in the last 5 years.
Hmm.
And I can see just in a few years that not only every group practice, but every individual practice will have some type of wellness protocol or
Hmm.
requirements. And you and I are both working on the Dental Mental Health Coalition, which is our
Hmm.
our new charity that we're working on getting our 501(c) validation very soon. And our goal is really to make this a requirement for
Hmm.
CE
Hmm.
that
Yeah.
every few years, whatever it is in your state, in California, it's 50 units every 2 years, that maybe we do 1 or 2 hours of CE.
Yeah.
That's it. That's all we ask
Yeah.
for,
Yeah.
right?
Yeah.
Because you have to do opioid, you have to do, why can't I think of the other ones?
Well,
HIPAA.
HIPAA, jurisprudence, HIV, all that
Yeah,
stuff.
you got to do all these requirements. Why don't we have mental health as a requirement?
Yeah.
Because you can take as 50 units of veneer courses and still be miserable,
Hmm.
still want to die,
Yep.
still want to quit your job and, be alone forever.
Absolutely.
And we can change this. And it's
Hmm.
not like this is some theory that
Hmm.
that Martin and I have created. We've proven this time and time again, and we see the the people that have gone through something like this, and it doesn't have to be our courses, but some kind of personal growth and how they change,
Hmm.
how they absolutely change.
Yeah.
And
And
everyone that they impact gets better too.
that's what I think people forget too. This is not just about us. This is about everybody around us. And when I became disabled, I realize now, I was depressed for a long time, and I became kind of a different person, both for mental reasons and also physical for about almost 10 years because I was in chronic pain every day. And sometimes you don't realize how it impacts and affects everybody around you, but it does. And so
Yeah.
this becomes a multiplier effect of, okay, so you're not just impacting, John or Jane dentist, it's everybody around them, their team, yeah, of course, their patients, but their families. And it just exponentially expands out from there. So it's more than just us.
Well, it's not just you. When you are depressed, your spouse feels it,
Hmm.
whether they have the self-awareness or not, they feel it.
Yeah.
Your kids feel it. Your dogs feel it. Like I
Oh
know, I
yeah.
know like when I was depressed, my bulldog, who's not with us anymore, she knew it. And she would come
Hmm.
sit next to me and she would put her head on my lap
Oh yeah.
and your dog knows. And here's the other thing too. You and I hear this all the time that nobody wants to work. I have this constant revolving door of
Yeah.
team members in my practice. The new generation is so lazy, they don't want to work. But it's hard to work for someone who's depressed all the time.
Yeah.
Someone
Well,
who's
I'll have
reactive.
more on that soon anyway, because I'm taking that course from Wharton and my brain is getting exploded.
Oh yeah.
There's actually some actual theories as to why, believe it or not. So yeah.
Yeah. I mean, but that's it. It's like, so I think back to myself. When I was deep in burnout,
Hmm.
anxiety, depression, I was not a great person to work for. I
No.
was very reactive. Like I was almost like on the edge of crying all the time.
Hmm.
I feel like a lot of people like that when they're depressed. And
Hmm.
so some small thing would happen. I didn't live between the stimulus and the response like we teach.
Yeah.
And I reacted quickly. And I would say things that were rude or condescending or whatever. And we lost team members, whether it was through me or other things during that time, but I didn't even have the self-awareness to know. I would just be like, oh my
Yeah.
gosh, like they just didn't want to show up.
Yeah.
But looking back on it, I think like, oh boy, I need to control what I can control. And part of that is taking care of myself, knowing my own emotions, knowing how reactive I was being. And so
So
you can impact your patients. You can even do better dentistry.
so let's talk about the three stories that we talk
Hmm.
about. So when we teach you crucial conversations, we talk about the three stories we tell ourselves. And they're a bit insidious. And the third one, in my opinion, is the worst of all. So the first story is, it's not my fault. And so when you say to yourself, it's not my fault, you take away any responsibility you have whatsoever for contributing to this situation.
Hmm.
So that's the first one. The second is, this is all your fault, where you're villainizing that other party, which negates any neutral or unknown positive intent that they may have that was behind the action. And the third kind, which is the worst of all, the most insidious, I guess would be a better way to put it, is, nothing, there's nothing I can do. That's the
Yeah.
helpless story, where you put your hands up and you completely give up and don't look for any solutions whatsoever. And then you just, kind of let things happen. And so that's probably the worst one,
Hmm.
because you're giving up at that point. So those are kind of the three stories in general that we tell ourselves. So
Yeah, and there are times when you can't do anything, and if you can't do anything, don't worry about it.
yeah,
But don't think you can't do anything if you actually can.
no,
And I
yeah,
know that's like
totally.
such a silly thing to say,
Yeah.
but in our courses and in my life, I like to think about this concept of control what you can control and don't
Mm-hmm.
worry about what you can't control.
Mm-hmm. Mm-hmm.
And that's one of those things. So if you're like, oh, well, I'm trying to think of an example. You get so frustrated because your hygienist kid gets sick and they have to cancel patients to go pick up their kid from school.
Yeah.
Could you control that? No. What could you
No.
control in that situation? You could maybe have a temp on speed dial.
Mm-hmm. Mm-hmm.
You could take over the hygiene. Other than that, there's not much you could do.
No. No. Now, the extent of that would, or the extension of that, which I know we both heard a lot, is, well, first they wanted this, and then they wanted this, and then they wanted that, right? And whether it's connected to kids or not is irrelevant. And so part of that always goes back to, and this again leads into neuroscience stuff, believe it or not, is, do we actually have SOPs in place?
Totally.
And if there's a
Yep.
change relative to somebody's hours, for example, have we put that in writing?
Hmm.
And if we put in writing the fact that, for example, this is the only change. Because if we don't have any of that stuff, then we have nowhere to go from. There's no threshold for us to then go back to and say, okay, wait a minute. So last month we talked about XYZ. We agreed to PDQ. We even memorialized this on this document. What's changed for you? Right?
Hmm.
Because the opposite, which is what you and I see all the time, is this frustration on the part of dentist leaders. And then they get to, there's nothing I can do, and they throw their hands up and they go,
Yeah.
everybody's this way. It's just a matter of time. Well, is it? And so that, and what I've also realized, and the times we live in help. What I've realized is people find SOP so overwhelming that they tend to brush them under the rug because they feel like they aren't that important, and then they never get done. But the truth of the
Well, it's
matter
not
is,
important until it's important, right? It's
exactly. Yeah.
kind of like having
Yeah.
an emergency kit in your car or,
Right.
something like that.
Right.
It's not important until it's important.
But the truth of the matter is, let's say you come up with one SOP you really like that has a structure, that has a template. Well, then the next thing you could do, you can use AI to utilize that template for
Hmm.
every single other area in your practice. And guess what? You don't have to do it all. You can
Yeah.
get your team to simply give you bullet points on the SOP for that area. And I'll tell you another little secret, ladies and gentlemen, it doesn't even need to be typed. Because when
Hmm.
I give workshops, I write on these big sticky pads. I take pictures of them, and guess what? AI transcribes them, manipulates them, does it in any way I want. So we're making this harder than we need to. And in the world of AI that we live in today, it's easier than it's ever been. And so it's getting to a point, I think we're almost there, frankly, where not having those SOPs because we don't have enough time and it's too much effort is it's getting toward pure excuse at this point,
I
utilizing
agree
those tools.
because we made SOPs by hand 14 years ago or whatever it was that we
Hmm.
bought our practice. And it
Hmm.
took forever. Be
Yeah.
honest. It took a long
Yeah.
time, like multiple years, like 2 years, I think, to get everything in place.
Yeah.
While we're running a practice, while we're treating
Hmm.
patients. But nowadays it doesn't.
Yeah. Yeah.
So let's bring this into land.
Yep.
What are your final thoughts on this? DSOs, DPOs, group practices, finally making wellness a priority.
I think one's just thank you to MB2 for having us, first of all. And at least if nothing else, proving the short-term concept because they were so blown away by the response and the reaction that we already have one on the books for next year already with them
Hmm.
again, which is amazing. Um, I think it's time for everybody to wake up. I really do.
Yeah.
Stop getting in your own way. Wake up, realize that we all have a problem. It's okay to not be okay.
Hmm.
And seeking something out like this is important, period.
Yeah. Yeah. Well, I don't know if I could even add to that, Martin. Really nice to virtually be in the same room with everybody that's
Yes.
listening here. We always appreciate you guys listening. Keep sending us messages, keep DMing us. We love hearing that. And we'll see you guys on the next episode of Wellness and Dentistry.
Bye bye.